Prachi here. Me and my team have decided to do this video because we in our clinic are having more of a patients coming post delivery, having neck pain, upper back pain, mid back pain, specifically the spine and the spasms around. So I'll just guide you with the posture, how you can do and modify your posture when you are doing the nappy changing. You don't have to sit on one side and then turn and rotate your back, or when you are doing it you don't have to bend too much while doing it. Otherwise, if you are in too much of the bending position and if you have not done your prenatal exercises well, or if you have not been the gym very well, then there are more chances that your core is weak, and then while bending for continuously for a longer time, and then you catch the spasm because then the muscle goes in a fatigue. So instead of that, why not to modify this position? You can take one cushion or go towards the dining table, and then on that you take the baby, put the baby there, and then you can change the nappy around. So you are not bending too much. Also make sure during your pregnancy, post-pregnancy also, as far as your gynec and physio permits you, start with your core strengthening exercise. So it will be much better and you are not holding one position for a longer time. So this was one of the modification. Then also I have noticed that when you sleep with the baby and the baby is inside, you are sleeping but your cushion is not, and there are some toys around. So why not to just move the toys and see whether which cushion will go, because you will be sleeping mostly in the sideline position. And if the cushion is not well around up over there, or if the cushion is really too soft, because then when you're sleeping on the side, my neck is just going down inside. Hence, check out our sleeping ergonomics video, that will guide you well, and suitable the cushion that you have to take, you take in that way. Don't always keep your hand overstretched or around the baby. You can just keep around on the side and be in that position. That way you can protect your neck spasms. Also, with the neck spasm, when I come around up over here, I see many moms carrying the bags of the baby on one side, and then with the baby you are carrying the baby on one other side, and then you are moving across. So that creates a spasm here, that creates a tightness around over here. Instead of that bag, it's always better to take the backpack. So when your backpack is there, you have put your backpack well tight enough. Also, you can take the baby and you can hold the baby, both the arms across, or you can use the kangaroo bags in that specifications, but make sure the baby, also it's a very good exercise for the baby too. When you put the baby on the sides and you hold them, make sure you change the sides. If you don't change the sides, you will also carry the baby on one side, and then you'll end up with the back going and taking in a wrong shape. One more thing which is really important is while feeding the baby. So while feeding the baby, if you are sitting upright, you are using a cushion, and then you are placing the baby, but then you are bending and you are slouching. So if you see my back, if I will be slouching completely down, it is again wrong for my back. So you adjust the cushions into that way. You adjust the cushions into that way that you are not bending too much. You are keeping it upright, and then you are feeding the baby while your spine is well. Also, make sure that your spine is supported then well behind. So in that context, I'll be sitting in the position where my low back is supported, and if I require one more support on my upper back, mid back, I'll be taking that. And I'll be going quite inside into it, and then I'll be feeding the baby. So I am comfortable, baby is also comfortable, my posture is not going in a faulty position. So these are some of the things that you should be taking care when you are changing nappy or carrying the baby bags or feeding baby. So this will prevent from all sorts of spasms around. Thank you.